You look very good today.
Feel very good, thanks.
And I heard that you're leaving Bladder Cancer Institute.
Yes, tomorrow I fly out.
Where are you coming from, or where you live?
Honolulu.
What is the reason you came to our institute?
Well, the reason I came to the Institute is about 2 years ago I was diagnosed with bladder cancer. And I went through 2 courses of treatment, BCG treatment. I repeated it again. I did it again for 6 weeks, repeated the test at the end, and they still found cancer. So only now the cancer they found was more serious.
Oh.
It could not be treated by the BCG.
So during that time, you didn't have any improvement with that treatment?
No.
Oh.
Well, I shouldn't say that. Some of the cancer that I had in the beginning disappeared, but new cancer grew.
Oh.
I went to another urologist. I wasn't satisfied that I had gone through all of this and I wasn't any better off than I was in the beginning. The first thing the new urologist did was send me for a CAT scan. And in the CAT scan, we saw the wall of the bladder at the bottom had a huge tumor in it, at least by my estimation, had a huge tumor. He told me that the only thing that they could do would be to remove the bladder. And I would wear a bag on my side for the rest of my life. He also offered me chemotherapy, which I've had friends take chemotherapy and die, not from the cancer, but from the chemotherapy. He offered me radiation, not IMRT, but regular radiation. And I have had friends who I've had to help treat because of the burns on their body from radiation. So I wasn't going to do that. And then he told me that the surgery was only a 50-50 chance that I would come out of that with no cancer. I asked him, well, if I do nothing, doctor, how long will I live? And he said 2 years. So after I thought about it for a few days, I called him back and I said, I think I'll take the last alternative. Because I'm more concerned with the quality of my life than the length of my life. Just by chance, a friend of mine, I've known him for 35 years, who knew that I was being treated for cancer and was just calling me to find out how it was going. So I told him what I just told you. He said, I'm gonna make a call and I'll call you right back. That's all he said to me. So he called me back in maybe half an hour. And he gave me the name of a doctor and a telephone number. He said, I've talked to this doctor. He's a friend of mine. I've known him almost as long as I've known you. And I want you to call him. He's expecting your call tomorrow morning at 10 o'clock. His name is Wolfstein. So I called him. And I told him everything I just told you. And he said 4 words to me. I'll never forget him. He said, I can help you. He didn't say he's going to take out my bladder. He didn't say he was going to give me any horrible radiation or chemotherapy. He said, I can help you. And he told me all about what you guys do here. He told me about the hyperthermia. He told me about the IMRT. He told me none of it would kill me. And that he felt there was a very, very good chance that, that's the way I feel, that I would be out of here cured. Minimum 3 months, maximum 6. Well, he missed the 6 months by 2 weeks. I'm leaving 2 weeks early. I have had virtually no reactions to any of this therapy. I mean, yeah, I've had some bowel symptoms where I've had a little diarrhea. I've had sleepless nights, but I think that's anxiety. I'm not sure what it is. But anyway, I've had very few. And in fact, my checkout that he gave me, my release, said that it's remarkable how few symptoms I've had, how little problems I've had. When I first came here, he sent me out for a PET scan and a CAT scan. And the PET scan showed the only cancer was in the bladder, which was good news. And the CAT scan showed the same as it did when I was with the doctor in Honolulu. He did a bone scan in November around Thanksgiving, and another CAT scan, and the tumor was still there, but Dr. Albalsam thought it was dead. He didn't say it in that many words, but he said, "I don't think it's active anymore." But we continued the treatments through the Christmas holidays until last week, and I went again for a PET scan and for a CAT scan. I'd also been tested, or had my urine tested 2 or 3 times here. The last fish test I had, which was a couple of weeks ago, we got the results last week. Negative. This PET scan came back negative. The CAT scan came back negative. So all the tests are negative.